Hi there, it's Gabrielle Nicolay from SpeechKids, where we teach little kids to talk and help parents understand their little kids. And today I'm really excited to be talking to Michelle Buzgon. Michelle, welcome.
Thank you. Thank you. It's nice
Tell
to
the
be
good
here.
people who you are and what you do and introduce yourself a little bit.
Hi. Well, I'm as you said, Michelle Buzgon. I'm an ADHD coach. I work with people who have ADHD and sometimes the parents who love the people with ADHD. And I've been a coach for a long time, and I've been exclusively coaching people with ADHD since 2012.
And one of the things that you really like to do is part of your work is to teach parents how to, I love the way you said it actually, which is you help people who love people with ADHD. um, and some of the families watching have little kids, and obviously those people will not be having a diagnosis of ADHD
Mhm.
for quite some time. When can ADHD be diagnosed usually?
Well, I'm not a diagnostician, so I will say that. But typically, people aren't diagnosed. The first time you can really do the cognitive testing that you need to do is earliest, usually around 5 or 6.
Yeah, that's
That
real.
seems to be my experience, and that's still pretty early. And there are, as I'm sure you know, there are some kids like something's up earlier. And I'm a big proponent of advocating for yourself and for your child when that's the case, because I've seen parents really struggling with that. Like, people are saying, oh, they're just kids, they're just but often parents know, they
Yeah.
know something's up. And it may not be medication, it may be other treatments other modalities, and even speech therapy obviously is a piece of that, because if they can communicate better, they may be able to present their
Present better.
better. Yes.
Right?
Yeah, yeah,
Yeah.
yeah, yeah,
And
yeah.
it's so interesting what you just said. People sometimes think, you know, diagnosis of ADHD automatically means medication. And I'm sure some of the people you work with take medication, and I'm pretty sure a lot of them don't. Or maybe they all do. I don't
Yeah. it's
know.
it's a mix, and I'm not I'm kind of, I would say I'm like Switzerland on it, but I'm not, because I will advocate for it if I believe somebody is being should really consider it,
Mhm.
at least even as a temporary measure, so that they are more available to learn the skills that I have to offer them.
Yeah. Yeah. So, okay, I'm so glad you mentioned availability, because we talk a lot about sort of being available to learn.
Yes.
Um, One of the things that happens with particularly the kids in my practice and many of the families who are watching is, they've got kids who go from 0 to 90 in no time at all, right? They've
Mhm.
got these like
Mhm.
boom, explode. And then, of course, what happens? Parents explode right behind them.
Right.
And so this is something you have a lot of experience with. Is
Yeah.
like helping people find that moment of, you referred to it earlier when we were talking, as the moment of pause. Can you talk a
Yes.
little bit about that?
We could just take a little pause here for a second. Maybe I was like, oh, maybe I'm not breathing right now. Yeah. So, I want to come back to something you just said a minute ago, which was about going from 0 to 90. And what I find is probably one of the least known, but most impactful pieces of ADHD is is emotional regulation.
You're blowing my mind right now. Keep talking.
Yeah.
Yeah, go.
And people don't realize that whole 0 to 90 thing is that's what's happening for them. And when you can understand that as um as Ross Green might say, the writer of The Explosive Child is his
Mhm.
most well-known book. You're looking for their lagging skills, and when you can start to see that as a lagging skill rather than as a character flaw in them, you as a parent can approach your child differently.
Mm. I have chills as you're saying that, because really that's like the whole essence, right? It's like
Yeah.
n- not treating um, bad behavior
Hmm.
as obstinance, laziness, uh,
Yeah.
badness,
Yeah.
right?
Right.
All of
Right.
those things, right?
Right.
It comes from
Right.
somewhere. There's a reason for it,
Yeah.
and getting curious about the reason,
Yes. Yes.
and
Because
that's
you're
something.
looking for you want to be looking for what's really going on here. What they're really struggling with.
That's so interesting. Yeah. Okay, so emotional regulation is a
Hmm.
thing. This
Yeah.
is right.
It's a thing. It's totally a thing. And it's probably when I work with a lot with college students and adult clients, and um, especially the adults, when I mention emotional regulation, they're like, it's as an executive function,
Mhm,
they're like, oh,
mhm,
it's like the skies open up,
mhm,
and they are like that. They just, I think they're so grateful to hear that, to hear, a lot of my work, a lot of my mission
mhm.
is with my clients is to help them understand that it's not a character flaw, that the things that are happening with them are the things that have been challenging in their brains, and maybe they've developed some responses to it over time, um, that have been less than helpful,
Mhm,
that
mhm.
don't really serve them, but it was the tools they had at the time. So I'm sure in your coaching and in your work, come across this all the time. Like, a temper tantrum isn't bad behavior. It's something they can't communicate to you
Yeah,
in a different way,
right.
because what they have available to them at this moment
Yep,
is a
that's right.
temper tantrum,
That's right. That's the
right?
tool that worked the last time. It's the
Mhm.
easiest to reach, and it's the most available. It's
Mhm.
like got the best bang for your buck.
Yes.
Now, if you're 2 and you're nonverbal, that works pretty well.
Yeah.
If you're 5 and you're verbal and you're still
Uh-huh.
doing that, that's a problem.
Yeah.
So, yeah, I love what you're saying about this, right? Like,
And if you're the parent and you're still doing that, that's a problem, right?
right.
And not to do, like, we all have our moments. Like, God knows I have my moments. I want to be clear.
Yeah.
I'm far from a perfect parent.
Yeah. Oh, well,
But
I mean,
but what but when we follow them down into that hole,
mhm,
and we think that they're being bad, and we forget that they just don't have another tool
mhm,
available to them at the moment, or they don't know how to choose a different tool,
mhm.
for whatever reason, that we can get triggered and caught up in all of that, and we need to remember, for us, so here, long way around to the pause,
Yeah.
right?
Yeah.
In how we react. It's hard, they don't have I mean, little kids in general, right? They don't have the executive functioning to that doesn't even start till later, right? They don't
Can
have that to pause.
I want to push pause on you for just a second, because I want to explain what executive function is for people
Okay.
who might not understand, which is the part of your brain right here in the front. Your prefrontal cortex is the part that does the thinking. It's inhibition. You said a couple more of them earlier: selective
Task
attention,
initiation,
task
task
initiation.
initiation, being
It's
able to sustain attention, be able to get, yeah, like I said, task initiation. It's a big word for, like, getting started on something, like get up and go, right? To
Mhm.
get started. That's one of the things you see most with
Is
people, but also like I said, the emotional regulation
Yeah. And
is a
then the
big piece of that too.
organizational piece of it too, right? So
Yes, organization and
sequencing,
planning.
all that stuff, planning.
Yes.
So
Yes.
that's a set of skills that
Hmm.
sort of like recently boosted to the level of attention. I feel like recently, in the past
Hmm.
20 years. Yeah.
Yeah, I think
We
so.
used to
I
think that
think
people with ADHD, at least from a layperson's perspective, just couldn't pay attention. Right?
right.
Like
Right.
that is far from what's going on.
Right.
So,
No, there's actually stuff happening in your brain,
right.
some, neurobiological things that are that are happening that make it harder for someone with ADHD. But, we're talking about, you're working with little kids. I mean, executive functions don't form until later. It's why teenagers do stupid stuff.
Yeah.
Because they now say, they used to say, oh, your executive functions for a neurotypical person are developed around, around age 25 or so. So if people with ADHD are lagging in their
Mm,
brain development and maturity by about roughly 30%, you'll see some different numbers out there, but let's just say 30%,
mhm.
2, 3 years, 4 years, depending, sort of where you are, then, you're looking in your 30s till but now we know so much more about neuroplasticity. I mean, I think it keeps it now some people say 40, that your executive functioning isn't fully formed till then. So, I don't know those numbers, but let's just say, it's not till after college. It's why college students do stupid things too. And because you're handing them these keys to maturity, but they don't really totally know how to drive it yet. And so they can make some dumb decisions. So when you're talking about little kids, it's not even developmentally appropriate for them to have these executive functions. And I think sometimes we expect that a little sooner than they are available. And then if you're talking about somebody who's not neurotypical, then there
Even less
need
so.
even less so. Yeah.
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 So good. Okay. So now we have, for argument's sake, we have this preschooler who is, has poor emotional regulation because they're just a little bit wired, sort of, tense. They've
Mhm.
got a
Mhm.
language issue, so they're
Mhm.
engaging in some bad behavior for
Mhm.
communication. And now we've got mom and dad who are like, what is going on? And who are feeding, feeding, feeding. And now we come to, okay, how can we do this differently? What's happening here and what can be done about it?
Oh gosh. That's a big question
Oh, sorry.
because
No, I was trying to lead you
no,
back to the
oh
moment of
no, no,
pause.
no, the pause. Yeah, no, 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 no. But right. Well, so that's the first step, but then there are a million
Oh,
places you
yeah.
can go after that. So, right. But yeah, so first we pause. So the tendency is to react. And sometimes we're reacting from frustration, we're reacting from not knowing what to do, be our own like sense of like, oh my gosh, how am I as a parent, what does this say about me as a parent that I can't control this kid's behavior, right?
Mhm.
Sometimes it's from our own childhood histories, trauma, whatever, our own stuff. We all bring our own, everybody brings their own stuff into
Mhm.
parenting, right?
Mhm. Or our own
And
executive functioning issues.
or on executive functioning issues. Absolutely. So if you've got your own emotional regulation issues, it may not take much to trigger
Mhm.
your 0 to 90. Um, and so what invite people to do is pause, to just have that moment before you react. This takes awareness. This is not an overnight like thing. It's a new habit you need to build.
Mhm.
Um, to just pause for a moment before you react so that you can actually respond, as they say, a lot of people say, you respond instead of reacting. So you're being thoughtful, you're making a conscious choice. And in that pause, so sometimes it's hard to do a negative, right? It's hard to like just stop and not do something.
Mhm.
So
Yeah.
it can be helpful if you actually have something to do.
Mhm.
So for some people, that could be feeling your feet on the floor. That could be rubbing your hands together. Just something that makes you go, oh, and get present. Get really
Mhm.
present in the moment with yourself rather than reactive to your child or whatever else is happening.
Mhm.
And so that can be, and a lot of people use breathing. Breathing is a really common technique.
Mhm.
For some people, breathing can induce some anxiety. So can be helpful to find something else that works for you.
Mhm.
So it could be counting to 10.
Mhm.
It could
It's
be it's just something concrete for you to do, I think can be really helpful.
I love that. It's so interesting when you started talking about, you know, feeling your feet on the floor or rubbing your hands together. And I know you did this on purpose. You slowed down the way you were
Mm,
talking. And this is something I coach parents on all the time, I calmed down as a result of you getting calm.
yes.
That, what, you know, we're so ingrained sometimes in this like action, reaction, action, reaction, action, reaction, that when you have action, response,
Yeah.
you get a different outcome, like a really different outcome.
Yeah.
And so often just making that one little pause. And this is something, you know, people who give presentations, you know how to do this really well. Bill Clinton in particular knew how to do this really well, right? This whole
Mm,
notion of pausing and phrasing, but you take your audience with you. It's the same, right? You the parent in the face of a screaming child can model. This is what they're talking about with modeling, right? You can model calm. You're not forcing anybody to get calm. You're just putting it in the air.
they feed off your energy, right? And so if our energy is calm energy, then there's more of a chance. And I know that's not true in all cases. And so I don't want to make anybody feel bad that when they seem perfectly calm and their kids still bouncing off the walls, um, then there's something maybe more significant that you need to be looking at and looking at with a doctor or a therapist or a professional in your life.
Mhm.
um and it's also not necessarily a once and done thing.
Yeah.
It's
Yeah.
not a once and done thing. um I, like you, actually talk about the thank you. I use that as my metaphor for this. Like, you don't teach thank you and once and expect them to get it, right? And I know you teach this too.
Yeah.
But you teach it literally. I'm teaching it as a more of a metaphor. I'm like, you don't do that. So the same goes with behavior. You can't tell them one time, don't do that, and expect them not to do it. And in fact, I don't know, you might know about this. I don't know. I remember when my older son was little in preschool, and I was talking to like the school counselor, and she was talking about how little kids don't, the word don't is so abstract that they don't, it
It doesn't
doesn't
register.
register. And all
Mhm.
they hear when you say don't climb this bookshelf, don't climb on the bookshelf, they hear climb on the bookshelf,
Mhm.
right?
Totally.
Yeah.
That's
Yeah.
100% correct. That's right.
Yes.
Yeah, that's why we say use your walking feet
Yeah.
instead of don't run. That's a whole other thing. You know, it's interesting, and we're gonna wrap this up in a second, but I do
Okay,
want
got
to
it.
touch on this notion because we've come to it so well of um, somatic experience being a fancy word for getting with your body. And the
Mm-hmm.
reason I think of it right now is because we do this thing where we say, use your walking feet, right? You're
Mm,
talking about grounding, you know, when you're talking about the moment of pause,
mm-hmm.
you're talking about grounding your feet, rubbing your hands, doing something
Mm-hmm.
physical to
Yes.
help you get present. And so can you talk just like a teeny bit about like sort of what am I trying to ask you even? What's relevant about the body? Why does it matter?
Mm-hmm. Oh my gosh, because everything's there. We just don't pay attention to it. And sensation is happening in our bodies all the time. We just tend to live a little more in our thinking brains, generally in the society. And our bodies have a lot of information to offer, and they offer a way to self regulate. And
Mm,
that's why I got interested in this work as an ADHD coach, because it's about regulating your nervous system.
mm,
Because ADHD is all about having a really whacked out nervous system, right?
mhm,
So, um, the idea of giving people a tool through their bodies to be able to regulate their nervous systems is really, really important. And that's how, so you as parents to little ones, to help them start noticing like that, it could be a tool for helping them to calm down when telling them calm down. Like, how well does that usually work, right? No.
Don't bother.
they, right. They don't, even though that's theoretically a positive command, right? Like they don't know what that means. It's so abstract. But what if you walked up to them and took their hands and said, "Hey, hun," and look them in the eye if that's comfortable for them. If it's not, then not,
Yeah.
right? But to take their hands and like, "Oh, your hands feel really soft,"
Mm.
or notice what your feet feel like on the ground, just like we did for ourselves, as adults. Like, what do your feet feel like on the ground? First of all, it's a little bit of a distraction, right? It's a what's the word? Deflection.
Redirection.
The
Yeah. Yeah.
redirection. Thank you. I've lost all my little kid words
Yeah.
since teenagers, But yeah, so it's a bit of a deflection, and but you're also teaching them how to pay attention to their bodies and what their bodies feel like.
Yeah.
So it could be a tactile thing. It could be a pressure, like feel the pressure of their feet on the floor or the pressure of your hand on their hand.
Mhm.
Could be the temperature
Mhm.
of your hand. Is it warm? Is it cold?
Mhm.
Somewhere in between. Um, is it is there this may be a little abstract for little ones, but like, is there a color that comes to mind as you're doing this, as you're holding their hands? Like, do you see a color now, or can you imagine a color? What color comes to your mind? And
Mhm.
so all of these things are bringing attention
Mhm.
to what's happening in their
Mhm.
bodies and the responses their bodies are having. And bonus, they're gonna calm down.
Mhm. I love that. We're going to do a whole other podcast at some point about this because I think I think you're 100% correct. Like it's where all the things are.
Yes. Right.
um,
Right.
but we're going to leave it there for now. And thank
Yeah.
you so much for
Oh
being
my
here.
gosh. Such a pleasure.
Take
Such a
care.
pleasure. Bye.